The pre-procedure setup of Neptune 2 was designed to be very efficient. Once the rover is brought into the operating room, it can easily be plugged in and turned on via the main power switch, which is located next to the electrical cord. Insert the disposable manifold into the appropriate canister's receptacle. To insert the manifold, align the tabs of the manifold to the appropriate slots on the receptacle. Push the manifold into the receptacle and rotate a quarter turn to the right until the manifold stops. This will ensure that the manifold is locked into place. The following risk mitigation measures should be taken each time you use the Neptune 2 or Neptune Silver waste management system. Neptune 2. Do not use Neptune 2 in low suction applications that require vacuum levels below 50 millimeters of mercury, 2.0 inches of mercury, or 7.0 kilopascals, as this could result in injury to vital anatomical structures and or hemorrhage, both of which may result in serious injury and or death. The Neptune 2 vacuum limit is adjustable from 50 to 530 millimeters of mercury, 2.0 to 21.0 inches of mercury, or 7.0 to 71.0 kilopascals. Do not apply high-flow suction or allow extended exposure of suction to tissue associated with procedures that require either no suction, low vacuum, or low flow suction, for example, passive chest drainage. Always consider the type of tissue associated with a surgical procedure before using this system. Failure to comply may result in severe injury or death. Alternate methods of suction other than Neptune 2 should be used to provide respiratory tract suction and similar patient needs. The Neptune 2 system is not intended to provide suction to other suction-powered accessories, such as Plurivac devices. The vacuum level for the Neptune 2 can be displayed in the following different units of measure: millimeters of mercury, inches of mercury, or kilopascals. Users should ensure that they have a clear understanding of the units of measure that are displayed in order to avoid operating the Neptune 2 device at a higher or lower level of suction than the user expects and needs for a specific clinical application. To change the unit of measure on the Neptune 2, follow these simple steps. Push the bottom right control panel display button down and continue to hold until the system setup screen appears on the display. This should take approximately 5 seconds. From the system setup screen, push the buttons next to the arrow icons to highlight the appropriate system setting. Scroll down until you find Vacuum Display Units. Push the button next to the OK icon to select this item. Use the buttons next to the arrows to choose between inches of mercury, millimeters of mercury, or kilopascals. Push the button next to the OK icon to select the appropriate system setting option. Push the button next to the Escape icon to exit the selection screen. The Neptune 2 has a maximum vacuum level of 530 millimeters of mercury, 21.0 inches of mercury, or 71.0 kilopascals, and is therefore considered to be a high vacuum suction device. Customers should also ensure that all users of the Neptune 2 device are adequately trained on the appropriate use of the device and are fully aware of the applications for which it is intended to be used and the risks of using it improperly. Similar warnings apply to the Neptune Silver. Do not use Neptune Silver in low suction applications that require vacuum levels below 254 millimeters of mercury or 10.0 inches of mercury, as this could result in injury to vital anatomical structures and or hemorrhage, both of which may result in serious injury and or death. The Neptune Silver vacuum limit is adjustable from 254 to 483 millimeters of mercury, or 10.0 to 19.0 inches of mercury. Do not apply high-flow suction or allow extended exposure of suction to tissue associated with procedures that require either no suction, low vacuum or low flow suction, for example, passive chest drainage. Always consider the type of tissue associated with the surgical procedure before using this system. Failure to comply may result in severe injury or death. Alternate methods of suction other than Neptune silver should be used to provide respiratory tract suction and similar patient needs. The Neptune silver is not intended to provide suction to other suction-powered accessories, such as Plur-Evac devices. The vacuum level for the Neptune silver is displayed in the following different units of measure: millimeters of mercury and inches of mercury. Users should ensure that they have a clear understanding of the units of measure that are displayed in order to avoid operating the Neptune silver device at a higher or lower level of suction than the user expects and needs for a specific clinical application. The Neptune silver has a maximum vacuum level of 483 millimeters of mercury or 19.0 inches of mercury and is therefore considered to be a high vacuum suction device. Customers should also ensure that all users of the Neptune silver device are adequately trained on the appropriate use of the device and are fully aware of the applications for which it is intended to be used and the risks of using it improperly. The Neptune 2 waste management system has two reservoirs for collection. There is a 4-liter and a 20-liter reservoir that can be used either at the same time or independently during the procedure. Now determine how many manifolds are needed for the procedure, and if only one is needed, which size collection would be the most efficient. Attach the suction tubing to the ports of the installed manifold. Make sure all unused manifold ports are closed using their corresponding caps. Press the Vacuum System button on the control panel to start fluid suction. Then rotate the appropriate vacuum setting dial to adjust the suction level of the 4-liter and 20-liter canister. The corresponding vacuum setting will show on the small digital screen above the dials. Once the knob is stationary and the setting is no longer changing, the screen will change from showing the vacuum setting to the actual vacuum in the canister. Please ensure that you have a clear understanding of the units of measure that are displayed. Refer back to the Important Device Information section of this video for further details. Please note the following controls located on the user interface and their related system function. The IV pole height adjustment keys are the up and down arrow buttons on the control panel. They will increase or decrease the height of the IV pole as needed. To reset or zero the fluid level value on the fluid level display, push the Volume Reset button on the control panel. Both canister fluid level values will display a 0 value. If the 4-liter canister becomes full during the procedure, two options are available. 1. Switch collection to the 20-liter canister and resume with the desired suction level. Or 2. Press the Empty Tank button on the control panel. The empty tank action will transfer all of the contents of the 4-liter canister into the 20-liter canister, provided there is enough room for the small canister contents. This function will stop fluid suction to the 4-liter canister for approximately 20 to 30 seconds. However, suction will automatically restart once the process is complete. Remember that the empty tank option may only be performed 3 times between docking cycles. If smoke evacuation is required, install the smoke evacuator tubing to the smoke filter and press the smoke evacuator button on the control panel. From the smoke evacuator screen on the control panel display, push the buttons next to the arrow icons to increase or decrease the evacuator power level as required. Do not remove any attached suction tubing from the manifold. Make sure the vacuum level is greater than 0 so that suction is present for the canister with the manifold to be removed. Roll the suction tubing toward the manifold port to purge the tubing of fluid waste. Turn the vacuum setting dial to 0 for the canister with the manifold to be removed. Wait until the vacuum level reaches 0 before removing the manifold with the suction tubing. Using the arrow and unlock symbols, rotate the manifold toward the unlock symbol until the manifold is unlocked. Pull the manifold and attached suction tubing out of the receptacle, always keeping the manifold in a horizontal orientation. Properly dispose of the used manifold and attached suction tubing, always maintaining the manifold in a horizontal orientation. The Neptune 2 is a closed system and does not need to be emptied between cases. To use the system appropriately, simply insert a new manifold before each case and clear the digital fluid volume measurements. It is important to remember at the end of each day, or when the rover becomes full of fluid, to transport the rover from the operating room to the docking station for cleaning. Push the rover into the docking station and select the appropriate cleaning cycle. Use the buttons on the display screen next to the arrow icons to scroll and highlight the appropriate wash cycle. Then press OK. If a specific wash cycle is not selected within 10 seconds, the standard wash cycle will be performed automatically. After the docking cycle is complete, retrieve the rover and return it to the operating room. The rover may remain unplugged and turned off until the next time it is needed.